This is Dr. Howard Strassler with the Restorative 528A Operative Dentistry E-Lecture, OP11C, Non-Vital Bleaching, Materials and Techniques. You will sometimes see a single tooth that's discolored. It'll be discolored in orange, yellow, perhaps a darker color. These are referred to as endodontically discolored teeth. Why does it happen? Well, there is trauma to the tooth. And after the trauma to the tooth, the dentin stains. Think of bruising your arm after someone punches it, or you knock into something, or you bruise a leg. A bruise becomes a black and blue mark. And over time, that black and blue mark is dissipated as your lymphatic system and as your circulatory system draws off the blood clots that form in those areas. But when you traumatize a tooth and a tooth is bruised, the pulp is bruised, it bleeds into the dentinal tubules, and there's no mechanism for the dentinal tubules to get that bruise, that clot, to be removed from them. In fact, the discoloration that you're seeing, the bleeding into the dentinal tubules, that over time the hemosiderin products of the clot breaks down. It leaves residual byproducts that discolor the tooth. The discoloration can start as a pink color. It can changes to a brown, a gray, a black color, orange, yellow. But whatever it is, it doesn't match the color of the adjacent teeth. The tooth can end up being vital, where the pulp survives, but the pulp has some changes, or non-vital, where the tooth will need root canal therapy. We can do internal bleaching, because the stain is a dentin stain, by accessing the pulp chamber after root canal treatment. When using any non-vital bleaching technique, the tooth can't have any visible fractures, because we'll be using caustic chemicals that, if it seeps into the PDL through the crack, can cause periodontal difficulties, periodontal problems. So, a discolored tooth due to trauma. Keep in mind, not all endodontically treated teeth discolor. Teeth that need endodontic treatment due to caries and due to infections of the pulp won't discolor. The teeth that discolor are teeth that have been traumatized. In fact, the tooth may continue to be vital. We see that especially in teenagers, younger people, where the tooth is traumatized. It doesn't fracture, but the tooth maintains its vitality. But over time, the root canal and the pulp chamber decrease in size, to the point that when you look at the root canal on a radiograph, on a periapical radiograph of an anterior tooth, you can see a difference in size of that root canal and pulp chamber when compared to the adjacent vital teeth. This is referred to as the root canal on the radiograph, within the radiograph, becomes obliterated. The tooth will test as non-vital because the pulp has become very small, but it may not need endodontic treatment. I'll refer you to your endodontic course for the guidelines for evaluation. So, discolored teeth due to trauma, that if the tooth does become non-vital and requires endodontic treatment, there's a specific procedure that we go through in order to bleach out that discoloration. First thing we want to do is a tooth that will get non-vital bleaching needs to have the endodontic treatment evaluated. We evaluate the tooth, we evaluate the radiograph. When we remove the access composite resin in the tooth and the gutta percha, we evaluate it for any dentin cracks in the chamber or in the root canal after we access those areas. We're going to be using some very caustic chemicals in order to do our bleaching. These are materials that cause oxygen radicals and create the same bleaching phenomenon that we see with the bleaches we use for vital bleaching, where we're basically taking the stain, the discoloration of the hemosiderin products, and we're breaking the double bond of that discoloration of that stain, and while the residual products are still there, the stain is removed and the tooth returns to its original color, or very close to that original color. Bleaching is not 100% effective, and typically Non-vital bleaching has a half-life of about 5 years where we will see relapse. The chemicals that we'll be using will be a hydrogen peroxide in generally the 25 to 35% range, 35% carbamide peroxide, or a sodium perborate, which comes to us as a powder that we mix with water in a specific ratio to create a paste that we'll be putting in the pulp chamber. So the tooth that we'll be doing non-vital bleaching for will place a dental dam. We want to seal the gingiva from any caustic chemicals getting in place and causing an adverse tissue reaction. We'll be using a low-speed, long shank round burr, and we'll be measuring from the incisal edge to be at least a millimeter subgingival, 1 millimeter below the CEJ. We're going to remove the composite resin in the access opening. We'll be removing the gutta percha to be subgingival. When we're removing the composite, we want to make sure all the composite's removed from the internal of the tooth, from the pulp chamber, from the dentin, because we'll be using the bleaching agent to penetrate into the dentin. If there's adhesive composite or glass ionomer in those areas, that'll interfere with the bleaching of those dentinal tubules. Once we've removed the gutta percha to a millimeter below the CEJ, in many cases subgingival, we're going to place a sealer to the gutta percha so that the caustic bleaching chemicals don't travel down the length of the gutta percha. Typically, we're using a conventional glass ionomer, and our best choice is the Fuji 9 material. We'll be syringing in a very small amount, tamping it in place, letting it set, and then we'll use a round burr to make sure there's no glass ionomer on any of the dentin walls. The glass ionomer is only in the area covering the gutta percha. So we've created a seal. When choosing bleaching agents for non-vital bleaching, typically at the School of Dentistry, we're using sodium perborate. It's the safest chemical for use for non-vital bleaching. You could also use hydrogen peroxide. You could also use carbamide peroxide. When using any of these chemicals, you must use the dental dam. Hydrogen peroxide, if there are cracks in the tooth or you don't have a good seal, has been implicated in periodontal PDL compromises that in some cases causes the tooth to be lost. So for this case, we're going to be applying sodium perborate as a bleaching agent into the pulp chamber. Remember, we've cleaned the gutta percha so that we're a millimeter below the CEJ, below the free margin of the gingiva. We're placing the sodium perborate paste. We're mixing it in a 2-gram powder to 1 millimeter ratio, and we're putting this paste in the root canal. Once the paste is placed in the chamber, we cover it with a cotton pellet. We etch the enamel for 10 seconds, rinse and dry. The cotton pellet is removed and the access is sealed with enamel bonded with composite resin. We leave the pulp paste in the pulp chamber for at least 4 days and up to a week. We evaluate the color during the color change. We repeat this procedure every 4 days to every week until the shade matches the adjacent tooth. Once we get a good shade match, we stop the bleaching immediately. The reason for the range between 4 days and a week is some patients can't make it in on a regular basis. It does no harm to wait within that range of 4 days to a week. Once the color matches, we're going to restore the lingual access with a bonded composite resin. We remove any of the paste from within the tooth. We can then place a temporary stopping in the tooth, and we wait 1 week before restoring, because remember the oxygen radicals create a compromise to the adhesive bond. For this case, it took 19 days of bleaching in order to get a reasonable color match between the two teeth, between number 8 and number 9. So here we look at a preoperative view where number 8 is discolored, has a dark orange-yellow color. 19 days after bleaching, we have a nice color match. We do our composite restoration, and we can see on the 2-year recall that the tooth and the root canal therapy are doing satisfactorily. There are other reagents that we can use. For this case, number 9 was discolored. It was a non-vital, endodonically treated number 9 that had endodontic staining, that had trauma. During the trauma, the tooth was fractured and it was smoothed out with a disc. In this case, we're doing everything that was described earlier, except this time we're using a 30% hydrogen peroxide. We're using that 30% hydrogen peroxide on a cotton pellet. We must use a dental dam, and with hydrogen peroxide, we're going to, during the visit, heat it up with an instrument. We can use an open flame, we can use an inductive heater. We're heating the cotton pellet with the hydrogen peroxide. The heating activates the hydrogen peroxide, makes it work more effectively. We do this 5 to 6 times, refreshing the bleach between each time that we're doing it and heating it up. We do this over 2 to 3 visits, once again 4 days to a week, and that we're sealing that hydrogen peroxide in the tooth, either using a temporary stopping material or we can use composite resin. After 2 weeks of non-vital bleaching, you can see the postoperative result. Now for this case, we used a 30% hydrogen peroxide. We had a dental dam applied to number 8 and number 9, and it wasn't applied very well. The bleach leaked through the dam and got onto the soft tissue. You can see the white tissue burns, caustic burns, chemical burns of the soft tissue. In some cases, these burns can cause the papilla to actually recede, leaving a black triangle. It's important that you place a well-sealed dental dam. Another technique that's been described in the dental literature is what's called inside-out bleaching, where we're doing a simultaneous vital and non-vital bleaching of the tooth. We're using a combined conventional non-vital bleaching technique with a conventional vital bleaching technique using a tray with a 15% carbamide peroxide. So for this patient, we did what we typically do for a non-vital bleaching procedure. In this case, the endodontic treatment was done by the endodontist, and in their report back, they told us that there were no root fractures, no cracking in the root, that all the composite was removed, there's internal staining, that it's okay to bleach. The access has already been opened. We removed the gutta percha to a level same as the bone, below the free margin of the gingiva. We seal the access in the gutta percha with a conventional glass ionomer Fuji 9. We do our conventional non-vital bleaching with a 30% hydrogen peroxide, heating the hydrogen peroxide 5 to 6 times. Once we've completed that, remember we still have the glass ionomer in place. We then take off the dental dam. We actually leave the pulp chamber open. The patient's going to be wearing a mouth guard for 2 weeks with a 15% carbamide peroxide. The reason we're using a carbamide peroxide is we want the patient to sleep with the tray. The patient's shown how to remove any food or debris that gets into the pulp chamber using a toothpick. So we're doing an inside-out vital bleaching procedure and a non-vital bleaching procedure. So for this patient, over a 2-week period of time, remember we did 1 visit of non-vital bleaching, and then 2 weeks of vital and non-vital bleaching together, we got this result. What we typically would tell the patient that when the teeth match, they need to come back in, the bleaching's been completed, they can stop the bleaching procedure. Once the bleaching's completed, we then go in and place our composite resin restoration. This has been Dr. Howard Strassler talking to you about non-vital bleaching in the E-lecture OP11C.